the initial treatments happened basically in the late 80s. We finally got the Western blot test where we could screen for blood and validate previous tests for antibodies and that type of thing in the late 80s. Then, the AZT and preceded the antiretroviral therapies, which we have today, which is called ART. So there have been tremendous progress over the last 30, 35, almost 40 years now in the medications. Now there are shots that can be taken, whether monthly or every other month. They're working on some things. They're even subdural testing to see if that would be something that would have a continuous medication flow for those who are living with HIV. It's who knows? The thing about HIV is it's a disease that can hide. It's a disease that can mutate. So there are all kinds of factors that have to be calculated into that. And, I don't think any of us have how long it's going to be. Do I personally, off the record, as Lisa Barr, think that it's going to happen? Absolutely, someday. But when exactly, no one knows. We just know that the progress that's being made is incredible. And, it's gone from a death sentence primarily to a long-term chronic disease at this point. I think one of the biggest ones, and there are actually two, in the prevention side, we're looking at PrEP, which is a pre-exposure prophylactic. And those are the things that I make the analogy of birth control. When you take it as prescribed, with other measures such as condom usage or not sharing injectables. Those are the things that can help prevent people from acquiring HIV. And then if in an emergency basis, there's PEP, which is the post prophylactic. And that is the one that someone's been assaulted, if there's been a on-the-job needle stick. Those are the ones that taken within 72 hours of that exposure can almost assure that you won't, acquire HIV. So those are the biggest tools that we have right now. The biggest hurdle that we have is still the stigma associated, the lack of education. People don't know what they don't know. And unfortunately, they don't know they need us until, they've been diagnosed. So those are the things the real challenges that we work with every day. I think for healthcare providers, the biggest thing that we could do is normalize conversation. HIV is still the greatest stigmatized disease state out there. It's criminalized. People can be thrown in jail if doesn't even have to be transmitted, but if they're not disclosing, and those are the kind of things that that we would really like the medical community as a whole's assistance with. As a nonprofit prevention and treatment organization, can't tell you how many OBGYNs, primary care, ERs, urgent cares, all of those things, they never talk about HIV. They never offer the test. And unfortunately, at least in the state of Florida, it's an opt-in instead of an opt-out. They don't ask if you have high blood pressure or care or high cholesterol. And, when they run a lab test, they just do those. Those are normal things. You have to ask for an HIV test. And sometimes that reaction from the medical community is, what have you done wrong? There is no shame. There's nothing that someone who is asking for that preventive test, it's part of their overall health and their sexual wellness. So having those conversations with all of their patients, running the test, HIV tests are very cheap. You know, so let's run those tests, let's find out who has issues, and then let's link them into care. Because care and being on antiretroviral is another way to prevent the spread of the disease.